My name is Dr. Githinji Gitahi, and I'm the Group CEO for Amref Health Africa. Kenya and many African countries are introducing Lenacapavir as a long-acting HIV prevention commodity or medicine. We have had previous long-acting preventive medicines, but they were required to be taken at least once every 2 months. And before that, the normal pre-exposure prophylaxis was meant to be taken on a daily basis, the drugs you take on a daily basis. This coming now means that people who are highest at risk of HIV infection can now take an injectable that is once every 6 months, and therefore they can prevent themselves from contracting HIV up to 95-96%. So it's highly effective. Innovations like this sometimes come at a very high price. Specifically, Lenacapavir was costing $40,000 per year, meaning 2 doses, $40,000. But through Global Fund and with partnership with countries, Kenya, Zambia, Zimbabwe, and others, they have been able to bring down the cost to $40 a year from $40,000. Therefore, we celebrate this moment not only in the countries where it is, but a great global health collaboration and solidarity moment. One of the biggest challenges we are going to have is awareness. Awareness, because people will ask, what is this? Is this a vaccine? What if I get an injection? How often do I get it? Do I get it for the rest of my life? All those questions. The most important thing is, therefore, who is this for? This medicine can only be given to people who are HIV negative. So if a community member is living with HIV, they have to continue with their ordinary medication. This is not a HIV vaccine, and it is not a treatment for HIV. This is for people who are, 1, HIV negative, secondly, a high risk of transmission of HIV by nature of their work, where they live. And we know, for example, that the biggest risk lies with adolescent girls under 24 years. This drug, this injection, Lenacapavir, is not a replacement for HIV preventive measures, meaning that people are still advised to continue having safe sex, use condoms correctly, avoid what we call unsafe sexual behavior. For this Lenacapavir injection, it is being integrated very well in the countries where it's being introduced with the primary healthcare system. It comes packaged with the syringes and needles that are needed for its administration. So it's completely self-contained kit. Global Fund has come to finance the initial doses, and because the cost is only $40 per person per year, it's easy, and because it's also not going to 100% of the population like a vaccine would, it's going to people who are highest at risk. The good thing with this is that it is one of those drugs that if we budget and continue, you expect to administer less and less, because you're basically saying that the HIV infection rates will reduce, because the rate of infection, by increasing pre-exposure prevention, you'll be getting less and less cases. By the end of 2027, maybe early 28, generic production will be allowed, and that will further reduce the cost and make it even more available. So those are the considerations for sustainability.